Family is the best thing someone could ask for. They are there for you through the ups and downs and love you unconditionally. Family is this very deep, complex thing that for most people becomes everything. Today, we are going to show you the case of our chosen family, the hardships, the constant toil, and risks that they face in their everyday life. Community health nursing is a medical specialty that focuses on the physical and mental well-being of individuals in a specific geographic region. We, as student nurses, interviewed and visited the family. We gathered data and recognized that the family had a lack of knowledge regarding healthy lifestyle, lack of family planning, and limited access on healthcare facilities and malnutrition as a result of poverty and the location of their home. We have also general objectives in this study, which are to help the family to formulate healthcare plan, promote self-sufficiency between the members of the family, disseminate data to advance legitimate cleanliness, as well as appropriate family discipline. Furthermore, we have specific objectives such as establishing and maintaining the family's rapport, gathering important information of the family, identifying the health problems and health history of the family to assess their attitude towards their health condition, give the proper health education, and utilizing the criteria and formulate nursing care plan for the family. Grandma Fox was born on April 27, 1947. Currently, she is now 74 years old and is now a widow. She has a granddaughter named Steph and a grandson named Alex. They were born on January 10, 2014 and October 18, 2018, respectively. In terms of educational attainment, Grandma Fox was unable to study at all. Only Steph, the granddaughter, is currently enrolled in 3rd grade. For income, only Grandma Fox earns as a charcoal maker, earning 400 to 600 pesos per month. However, Grandpa Fox, which is the husband of Grandma Fox, had died as well as their 4 children, Uno, Secondo, Thirdi, and Quadri. All 4 of her in-laws also died. All she have left is her grandchildren, which are Steph and Alex, while some of her grandchildren was taken by either their step-parents or their relatives. The family is considered to be an extended family since Grandma Fox and her grandchildren are currently living on the same roof. Grandma Fox took care of her 2 grandchildren. It was left to her when the children's parents died. Their religion is Mormons. Grandma Fox is the wife and head of the family. She wasn't able to have education due to the difficulty of hiding from danger during their time. Grandma Fox makes a way for them to survive. She is a charcoal maker and sometimes sell vegetables and fruits just to buy their food. As for the setting of the family, they are only settled on the side of the farm and is surrounded with large, vast trees. They don't have any source of electricity and the river is the only source of water they have. Their house is made up only of light materials like steel sheet roof with holes, bamboo, wood woven patchwork, and it has only 1 bedroom with a single window. They only eat on the ground because they have no tables and chairs where they also cook their food. Grandma said that sometimes there are snakes and a lot of mosquitoes at night, and when it rains, water gets inside their house and the roof also drips. The overall health status of the family is kind of alarming since they are at high risk of developing various diseases due to their practices. We have also checked the vital signs of Grandma Fox, Steph, and Alex, and there are also abnormal findings present upon conducting head-to-toe assessment. Through checking and calculating their BMI, Grandma Fox, at the age of 74, is underweight. Steph, at the age of 8, also belongs at the underweight category, and since Alex, at the age of 3, has lesser weight than is supposed to be weight according to the weight for age from WHO, have stunted growth. After the delivery, The children may have been given free BCG and hepatitis B vaccine. Moreover, when the children are ill, Grandma Fox gives herbal medication and uses traditional practices to treat them. Due to the pandemic that is happening, activities of the family such as going to church has been ceased. The family also experienced nutrition imbalance, affects their physiologic needs and mental capacity due to lack of stable job of the family, especially this current situation. There are also some health threats, health deficits, and foreseeable crises upon observation in the family, their practices, and their environment, such as first, fire hazard. It is because the family's house is made up of bamboo or kalakat which could be prone to fire, and since the children most likely to play in a sloping area at the back of their house, this could risk them from falling. The family often eat bananas and cassavas which they pick from their yard since they cannot afford and provide to buy proper meals. They also lack food storage facilities and has no electricity. Since the family's house is surrounded by banana trees, which is shady or dark, it can be inhabited and infested by mosquitoes. Their source of water supply is only taken from the river, and they were not able to check the water if it is safe for them to drink. From their illness states, there are visible rashes on the child's skin and the grandma is asthmatic. The family's environment has a poor sanitation and poor hygiene can also be seen in each of the family member. Also, the family has chronic illnesses, haven't yet been to have their vaccines, and there's already a history of death among the family members, and they have never been to a physician for proper checkup and medication. We have also identified the second level of assessment, which is composed of inability to recognize the presence of a problem, inability to make decisions with respect to taking appropriate health actions, inability to provide adequate nursing care to sick, disabled, dependent, or vulnerable or at-risk member of the family, inability to provide a home environment which is conducive to health maintenance and personal development, and failure to utilize community resources for healthcare. We discussed the specific problem and the reason behind these problems. We have also identified, computed, and justified the nature of the problem, modifiability of the condition, preventable of the potential scale, and salience of the problem of each health deficit, health threat, and foreseeable crisis. As a result, we have come up with a ranking of the following from least to greatest, such as the fall hazard, hospitalization of a family member, presence of breathing, illness state, poor lighting and ventilation, lack of food storage facilities, death of a family, and the top 3 health problem, which is the fire hazard, polluted water supply, and inadequate food intake both in quality and quantity. The family nursing care plan revolves on the top 3 problems based on the ranking list of the family health problem. These health problems are inadequate food intake, polluted water supply, and fire hazard. To address these problems, the student nurses came up with achievable goals and objectives that will be achieved through various nursing interventions. By home visitation, the student nurses gave health education for the topic of malnutrition, dangers of contaminated water, and the preventive measures for fire hazard. The student nurses utilized their time, effort, and knowledge aided with visual aids in carrying out their nursing interventions. In this study, we were able to identify various family health problems which put the family's wellness at risk. The student nurses took action and applied their extensive knowledge to address the top 3 existing problems of the family. Through giving health education and other nursing interventions, they provided the family with greater understanding and familiarity with their healthcare needs. With greater knowledge, the student nurses are looking forward for positive changes in the family's well-being.